Hello everyone, I'm Dr. Mukhopadhyay, a shoulder and sports injury specialist with Saksham Orthopedics. Today, I'll try and answer a few frequently asked questions about rotator cuff injuries.
What is rotator cuff and a rotator cuff tear?
Rotator cuff is a group of muscles which balances and supports your shoulder. It helps maintaining the central positioning of your arm bone over the socket. A tear involving any of these four muscles is referred to as a rotator cuff tear. These four muscles are the supraspinatus, the infraspinatus, teres minor, and subscapularis.
Where does the rotator cuff tear and how do you know it?
The rotator cuff can tear at its attachment to the bone, which is the most common site of tear. The next more common site of tear is where the muscle fibers change into a more tendinous structure or the muscular tendinous junction. If you have torn your rotator cuff, you will experience pain and weakness in your shoulder.
What are the most common causes and types of rotator cuff injuries?
The most common causes of rotator cuff injuries are usually chronic wear and tear leading to degeneration of the tissues, which followed by a minor or a trivial injury can lead to the tendon giving way and tearing. Other more serious injuries like a fall on an outstretched arm, in athletes who are involved in throwing activities, in elderly females who are more commonly diabetic or thyroid, hypothyroid, because of the changes in them, the tissues become vulnerable and tear even with trivial injuries.
What are the common symptoms of rotator cuff tear?
The most common symptom that a person with a rotator cuff tear will present to me with is pain. After pain, what they complain of is weakness and inability to move their arm above the shoulder level.
When should I see a doctor about a torn cuff?
You will be able to evaluate the status of your rotator cuff yourself. Try elevate your arm above the shoulder level. If you are unable to, probably you have a rotator cuff injury. Try elevate it with the help of the other arm and try hold it in the position. If you are unable to hold it in this position and your arm drops down, this also could be a possible sign of rotator cuff tear. If you are experiencing pain and one of these problems, I would suggest you visit your doctor soon.
How is a rotator cuff tear diagnosed?
A rotator cuff tear is diagnosed with good physical examination of your shoulder to elicit certain signs of the function of the muscle and confirm with an ultrasound or an MRI.
What is the average recovery time for a rotator cuff injury?
The rotator cuff injury after repair could take good 12 weeks to almost 6 months to regain full function and strength.
Can a rotator cuff tear be cured without a surgery?
Definitely, but it also depends on the grade of injury. Minor tears with minor fraying, incomplete tears, partial thickness tears may be allowed to undergo a conservative trial. Most of these patients would usually benefit with exercises and medication. However, if you have a complete full thickness tear, you may not benefit from non operative treatment procedures.
When should I have surgery?
If you are being diagnosed with a full thickness rotator cuff tear, which has been confirmed on an MRI, you should consider a repair. In case you have a partial rotator cuff tear, however, you have not benefited from rehabilitation, physiotherapy, and exercises done for at least 4 to 6 weeks, you may also, in that case, consider the option of a surgery.
How are major surgical injuries to the rotator cuff tendon repaired?
Rotator cuff repair is done using a minimally invasive procedure. It is arthroscopically repaired using specially designed biocomposite anchors.
How successful is a rotator cuff surgery?
The success of a rotator cuff surgery depends on the patient status, how medically fit the patient is, how physically active the patient was before the surgery, and how well he undergoes the rehabilitation. It also depends on at what stage did the patient present to the doctor with the tear. Fresh tears with minimal damage to the tissue, minimal retraction usually fare very good with a timely done repair. As the tear becomes old, the tissue quality may deteriorate, the tissue may get retracted, and arthritis may also set in the joint, which may compromise the final outcome. Although, even in these patients who have undergone surgery at a delayed stage, show significant improvement in their status, what was before repair and after repair.
Does physiotherapy help?
Physiotherapy has definite role in a rotator cuff injury. Even pre-surgery, it helps to condition whatever attachment of muscle remains, or it helps in strengthening the deltoid muscle, which helps in the post-surgery rehabilitation as well. So these were a few of the frequently asked questions from most of my patients regarding rotator cuff injuries. If you have any other question, feel free to ask. I would try and answer any of your queries related to rotator cuff injury. If you have been diagnosed with one, you may feel free to consult me, visit me, and discuss the treatment options. Thank you.